When your period suddenly gets delayed or starts coming at random times, it can feel confusing, stressful, and honestly a little scary too. Many women immediately think, is something wrong with my body? But here's the truth. Not every irregular period means a disease. Sometimes your body is simply reacting to stress, weight changes, sleep problems, hormones, or lifestyle habits. And once you understand how your cycle actually works, everything starts making much more sense. So today on ParentUno, we're going to talk about irregular periods, delayed periods, missed periods, and the real reasons why they happen in the simplest and most practical way possible.
First, let's understand one important thing. A normal menstrual cycle is not always exactly 28 days. For some women, a 22-day cycle is completely normal. For others, 35 days can also be perfectly healthy. A menstrual cycle is counted from the first day of one period to the first day of the next period. And usually, a variation of about 5 to 7 days can happen naturally.
But if your cycle keeps changing a lot, for example, if your period comes very early one month, very late the next month, or this keeps happening multiple times in a year, then your body may be trying to tell you something important. Now, to really understand irregular periods, we need to understand the hormone system behind your menstrual cycle. Don't worry, we'll keep this super simple.
Your entire cycle is mainly controlled by four important hormones: FSH, follicle stimulating hormone; LH, luteinizing hormone; estrogen, and progesterone. Everything actually begins in the brain. There is a part of the brain called the hypothalamus. It sends signals to another gland called the pituitary gland. The pituitary then releases FSH, which tells the ovaries to start developing eggs. As the eggs grow inside the ovaries, they produce estrogen. When estrogen reaches a certain level, the brain releases another hormone called LH. And this LH surge triggers ovulation, meaning the release of the egg. This is the same hormone detected by ovulation test kits that many women use while trying to conceive.
After ovulation happens, the ruptured follicle transforms into something called the corpus luteum, which starts producing progesterone.
Now, estrogen helps thicken the inner lining of the uterus, while progesterone prepares that lining for pregnancy. If pregnancy happens, the uterus is ready to support the fertilized egg. But if pregnancy does not happen, estrogen and progesterone levels drop. The uterine lining breaks down and sheds, and that becomes your monthly period. Now, the menstrual cycle has two major phases. The first phase is before ovulation. This is called the follicular phase. The second phase is after ovulation. This is called the luteal phase. Here's the important part. The first phase can vary from woman to woman. Sometimes the egg develops slowly, sometimes faster. That's why cycle length changes. But the second phase, after ovulation, is usually fixed at around 14 days, which means if ovulation gets delayed, your period also gets delayed. So anything that affects ovulation can affect your menstrual cycle. Now let's talk about the common causes of irregular or delayed periods. First of all, not all irregular periods are abnormal. Some stages of life naturally cause cycle changes.
For example, during teenage years, periods are often irregular in the beginning because hormones are still adjusting.
Pregnancy is another obvious reason why periods stop. Breastfeeding can also delay periods because a hormone called prolactin suppresses ovulation. And during the years before menopause, periods often become irregular again because ovulation becomes less predictable. Now let's discuss the more concerning or medical reasons behind irregular periods. One very common cause is thyroid imbalance. Another is high prolactin levels, which can happen due to problems involving the pituitary gland.
One of the most common causes today is PCOS or PCOD, a condition where the ovaries develop multiple small cysts and hormone imbalance affects ovulation.
Sometimes, irregular periods can also happen due to premature ovarian failure or early menopause, where ovarian function starts declining much earlier than expected. Lifestyle factors also play a massive role. Rapid weight gain, obesity, poor diet, lack of movement, excessive exercise, emotional stress, anxiety, sleep deprivation, all of these can disturb hormone balance and ovulation. Even physical stress on the body matters. For example, serious illness, surgery, emotional trauma, financial pressure, relationship stress, exam stress, or burnout.
And yes, certain medications can also affect periods, including some hormonal medicines, psychiatric medications, cancer treatments, and medicines used for conditions like endometriosis. Now, the big question is, what can you actually do if your periods are irregular?
The first step is simple. Don't ignore it. If your cycles are repeatedly irregular, get yourself properly evaluated by a healthcare professional. Second, focus on your lifestyle. Your hormones are deeply connected to the way you eat, sleep, move, and handle stress. Try to eat simple, fresh, home-cooked foods whenever possible. Reduce highly processed foods, excessive sugar, packaged snacks, and junk food. Maintain a healthy body weight. And remember, exercise should support your body, not punish it.
You do not need extreme workouts. Consistency matters much more than intensity. Walking, yoga, stretching, dancing, cycling, any activity you genuinely enjoy and can continue long term is far better than exhausting yourself for a few days and then quitting.
Stress management is equally important. But real stress management is not only about meditation or music, it's also about identifying the actual source of stress and slowly working toward fixing it. And one thing many people underestimate is sleep. Your hormones follow something called the circadian rhythm, your natural day and night cycle. Sleeping very late, poor sleep quality, inconsistent sleep schedules, all of these can confuse your hormone system and affect ovulation. Good sleep is not a luxury for hormone health, it is essential. And finally, listen to your body. Your body is constantly communicating with you. Irregular periods are often not the real problem, they are a signal that something deeper may need attention.
So nourish your body well. Move your body regularly. Sleep properly. Manage stress gently. And most importantly, don't panic. With the right understanding, healthy lifestyle changes, and proper medical guidance when needed, many menstrual cycle problems can absolutely improve. If you found this video helpful, don't forget to like, subscribe, and share ParentUno with someone who may truly need this information.